Yeah, it is crucial to make sure people have a warm place to stay because these single-digit temperatures with below-zero wind chills can be dangerous for our skin. Frostbite to exposed areas like fingers and ears can occur within 30 minutes, even faster depending on just how cold it is.
Akron Children is one of the first hospitals in the United States to use a new medication for frostbite therapy. Our Bob Jones explains how this works.
Stephanie Steiner, a nurse practitioner at the Burn Institute at Akron Children's Hospital, says it's been a tough season for frostbite. About 15 cases since December.
Temperatures in the teens and tens, and then we've had a lot of wind chill factoring into that, taking our temperatures well below zero. And so we've definitely seen a spike in our frostbite.
But Akron Children's is one of the first hospitals in the U.S. using the drug iloprost for frostbite therapy. It's given through an IV in a 6-hour time frame over 5 days to reduce the risk of amputations.
And what it does is kind of help us dilate our blood vessels out so we can get better blood flow to that injured tissue to help hopefully salvage some of that tissue that could die off because of the frostbite.
The medication has to be given to patients within 72 hours after their bodies are rewarmed. And Stephanie told me she believes there have been 2 or 3 cases when fingers or toes have been saved because of the frostbite medication. Steiner estimates iloprost has been used on 10 patients so far. To avoid possible serious cases of frostbite, she stressed to dress in layers if you have to be outside and be aware of the warning signs: tingling, numbness, and skin changing colors.
It can kind of look a bright red color or really pink and maybe just a little bit painful. As it progresses, certainly it gets more pale and turns kind of a bluish purple color, and that's when we're really in a danger zone. They really need to get probably to a hospital to be evaluated.
In Akron, Bob Jones, News 5.